I made a video talking about how most patients become hypotensive after intubation. And this person commented that they've seen a lot of patients become hypertensive. And so let's talk about it. More often than not, after you intubate, patients are going to become hypotensive. And if you are curious as to why, follow this comment back and you can see the original video. But every once in a while, you may see a patient become hypertensive. And the most common reason for that is probably because that patient is paralyzed but not sedated enough. Before you intubate someone, look at what their heart rate is, their average trending heart rate in that moment, as well as what their blood pressures have been trending. If you intubate that patient and then a couple minutes after they're intubated, you see their heart rate shoot up to 180 and their blood pressure is super high, but your patient's chill, they're not moving. It's probably because they are still paralyzed and they are freaking out. That's why it's super important to know all of the durations of actions of the medications that you are giving your patient. So that way you can be like, okay, I just gave them some rock. How much time do I have until that paralytic wears off? And if you've taken my ICU crash course, you have access to my PDF printout of all the durations of actions of all the RSI medications that we most commonly give. I will also add that some of the RSI medications that are used can cause hypertension, such as ketamine. However, I still stand by the fact that the majority of patients, after you intubate them, will become hypotensive. Hopefully that helps. Let me know if you have any questions.